I have a congestive heart failure. I did have a pacemaker and a defibrillator put in.
Not so long ago, a senior with a chronic medical condition might be forced to live in a nursing home, but that's no longer the case.
Good morning. It is now time to record your vital signs.
I'm giving my vital signs every morning at 8 o'clock. They are sent over to the hospital.
Place the blood pressure cuff on your right arm, above the elbow. Tighten it securely. Have you been having any chest pain?
Telehealth monitoring is a new concept in the delivery of medical care, but experts say this technology can actually reduce hospitalizations for seniors.
Based on their vital signs and their responses to those questions, we're finding out the little cues that are letting us know that the patient's running into a problem before they actually have to go to the hospital.
Winthrop's telemonitoring program began in 2005, and there is no charge to participants. Weight, heart rate, and oxygen and glucose levels are monitored daily.
I haven't been to Winthrop that often. Before that, I was going there over, for one reason or another, every 3 or 4 months.
If an abnormality is detected, the patient is immediately called and asked to retest. If the retest is also abnormal, a nurse is sent to the patient's home to determine if immediate medical care is needed.
It feels as though someone's watching over me, which is very comforting and reassuring.
Virginia Cravata, News 12, Long Island.
Heartbeat on your...
I didn't like to move when I was young, and I think as you get older, you dread it more.
Mildred Zinberg dreads moving so much, she's making sure she doesn't have to do it again. Mildred is planning some major renovations to her new Hyde Park home, where she's lived for 45 years and raised 3 children. Mildred wants to make sure her home can accommodate the needs of an older person.
The reason that I'm doing this fits in with my philosophy of preparing for the next step.
Designing a senior-friendly home is all about creating smart spaces, indoor and outdoor living areas that emphasize comfort and safety without sacrificing style.
A lot of the things that we can do to the home doesn't look like it's quote-unquote handicap or special need.
Physical therapist and environmental consultant Frank Frangeli says that universal design renovations often begin in the bathroom.
What we have here is varying countertop heights so that any person, any age, any ability can access the sink and the countertop effectively.
A bathtub can also be replaced by a shower stall that can hold a wheelchair.
The shower area is oversized. It's 5 foot by 4 foot, and it's open on 2 sides to allow for a greater maneuverability.
Another tip for creating a barrier-free home, reduce door thresholds to 1/4 inch. Dr. Jeffrey Rosenfeld, author of Home Design in an Aging World, says it's all about doing what's right.
It's not just about the technology. It's about loving and respecting seniors and creating environments where they can be happy.
And Mildred Zinberg hopes she'll be happy in her home for a long time to come.
It does make a lot of sense, I think, to make the home you're in serve you the best.
Virginia Cravata, News 12, Long Island.